My name is Andre Guad, the chairman of John Theurer Cancer Center at Hackensack University Medical Center in New Jersey. I'm very happy to be part of ASCO 2017 with our team as well. And every year we see more and more confirmation of the trends in cancer, the dramatic changes in oncology at multiple levels. Increasing of immunotherapy, what we call immuno-oncology, using immunotherapy to improve the outcome of patients. Novel therapies, small molecules, biological targeted therapies, precision medicine, but all of this in the context of trying the emerging concept of value-based care and being really patient-centric. So I'm very proud to say that John Theurer Cancer Center has been very highly engaged and involved in many of those presentations. And I would say I highlight just 4 of these presentations. Immunotherapy, CAR T cells is really one of the big topics at ASCO. And although several of the presentations at ASCO will confirm the activity already presented at ASH, this is also showing continuous response and some patients potentially cured in lymphomas, acute lymphocytic leukemia, multiple myeloma. So we are part of several presentations, including in relapse refractory large cell lymphoma, the update of the ZUMA-1 trial with a response rate over 80% and 54% complete response, 44% maintained response at a 9-month follow-up. So that's very impressive. And also emerging data in multiple myeloma with a Bluebird study that is that is done in our center here as well, where we have 11 patients that were presented at ASH, an additional 10 patients that will be presented, including complete response and what we call MRD negative patients in multiple myeloma. So that's very, very encouraging. So there will be many updates about the CAR T cells setting. The second aspect is very relevant from John Theurer Cancer Center presence at ASCO is in multiple myeloma, where we have one of the largest programs multiple myeloma in the country. And we have several presentations that are focusing, I would say, on building up on doublet triplets in multiple or biological therapy in multiple myeloma. So they have been very well established in a relapse refractory setting. They have moved to the frontline setting, and now we see the addition to monoclonal antibodies that actually improve again the activity and the complete response rate, or what we call very good PR in context of multiple myeloma. We also see the addition of other agents, including immuno-oncology and checkpoint inhibitors with multiple myeloma with very promising results. And we actually are studying those here, have ongoing studies looking at using checkpoint inhibitors such as pembrolizumab plus lenalidomide post-radiotherapy and transplant with very encouraging preliminary results. The third aspect, I would say, is our phase 1 program here led by Martin Gutierrez, which is a very large phase 1 with multiple first-in-human phase 1 studies. And we are presenting and part of presentation at ASCO with several abstracts, including particularly in lung cancer with novel agent and hematological malignancies, including lymphoma. And finally, in the context of big data and on how to help measure what we do, we have some presentation of our platform of analytics with CODA at ASCO, particularly through the what we call Living with Cancer Index that was established by Stuart Goldberg that will be presented on Monday at ASCO. And that's really important because this is trying to find a scoring system that helps us predict better the future patients when they come to our center. We're talking patients who are in a palliative setting, and we try to have a better idea of where they fit in terms of the journey. And that helps us, and then by establishing the score with 7 variables, Dr. Goldberg was able to establish a model that helps us predict when we should trigger a palliative consultation or hospice care in the context of patients with cancer. What was really interesting in the updated data presenting this year at ASCO is that this Living with Cancer Index correlates with survival, and that's very impressive. So all of this, again, we are building up as well on big data to try to go towards value-based care and try to improve the outcome of patients by helping reduce variance, optimize the decisions of enrichment, so therefore along the way reduce the costs and overall improve the whole picture. So I'm very happy that again this year at JTCC we're very engaged at ASCO and the future is very promising.